a nugget and we don't record it.
How do you go about diagnosing, as in, so like you said, like that might need a rotation as opposed to like a side bending, or like whether he needs more decompression, like a
I think that's the thing that we didn't.
What
really
we learned was
taught.
just if it looks like compressed and it's not moving, just anyway is fine.
These are things you can do.
Yeah.
These are the alternatives.
I'd go with that as an approach. I reckon, you know, there's no answer to what I've just told. I can't give you the answer.
Yeah.
I think, you know, when you start training, what they try to do is give you models so you can work with them, so that then you can have a place to start with, and then you can start to experience the truth. You know, we can't tell you the truth of it because you can't.
You have to work it out.
You kind of do. You know, that's the art in the science. You know, so we start with rotate, side bend, do it this way, and then eventually you start to go, hang on, that's not really locking up. Oh, it locks up more like that. Oh. To give you some ideas though, down and back for me, maybe once or twice a year.
What does that mean, sorry, down and back?
It's the way the facet, well, we were always taught it's the way the facet lines up. So I guess the facet loading up this way is going downwards and backwards, the facet, that plane. Up and forwards, it's going up and forwards. That's how we were taught.
Yep.
So if that gives you a visual, I do this very rarely, maybe because some people who might use that more than me probably don't do a prone CD adjustment. So I tend to use that in lower cervicals and probably a supine CD adjustment. But I would tend to, just my bias, I'd always tend to do a supine CD adjustment, where my preference is, you know, if the head's like that, where I'm decompressing like this. I don't mind these ones, but or these ones.
It's a great model.
It's actually.
But these tend to be quite compressive still, and most of us, this has got to be decompressed. So, how often do I do these? Once a year. Maybe that's my bias. How often do I do this? All day, every day.
Can we please go over that?
Yep. How often do I do a cradle up and forwards, a chin up and forwards? All day, every day. How often do I do a chin compared to a cradle? Well, I probably do cradle 99% of the time because I'm cheating in a good way. I've just cut corners. Most necks are easy. What I'm trying to help you understand is for that one neck that comes in, that's when you've got to have that one. And when I was starting, I only ever did chin holds. And it wasn't until, you know, you're seeing 20 odd a day, it's like, I've got to get more efficient with this. Same with dogs, I used to lift people up and get really like this. Then I'm not lifting them anymore, I just roll them and, you know, pretty much do that. So just cutting those corners. CD lift, no, once a year again. Lifts in general, a lot, but lifts for me personally is not my go-to for a thoracic spine. Generally a dog or an over my knee one, you know, and you do this one from here.
I've done it in ages, isn't it?
Fantastic technique for a lot of the patients I see in town who's that real kyphotic desk worker. So that might be why I'm doing a lot of them, to really open that chest up. Sam, on the other hand, very experienced osteopath, he'll have a different view to me because he pretty much lifts everything, you know. He's also this big and this wide, so maybe that's a thing. To him, just very easy.
Very easy.
So it's, you know, so that's what I say, go back to the start of what I said, you got to run it through your filter, figure out what works for you. But I'll still do them all, you know, so there's variations of dogs you can do, whether you have a wing up on this side, an arm up on this side, and you're doing that to compress through the shoulder. You do a dog to manipulate the shoulder. You can isolate rib heads from doing that, but it all comes out of being able to do a dog. So if you've neglected dogs, so I was trying to show these techniques to people. If you've neglected doing dogs and you're out of sync with that, but you're great with lifts, you're probably not going to be able to isolate these rib heads in that very fine way. So you just got to keep practicing them all, and then later on, choose whatever you're best at. What we're going to do?
Supine.
Okay, great. So
Prone CD.
this
The
is
one I did on you.
Yeah, okay.
this is one of the techniques that I would call one of those supa, dupa techniques, the secret technique. It's a secret technique, but everybody knows it. I say it's secret because for me, in my practice, sorry, excuse me, it is the technique that I reckon, just lift your head up there, mate, is that for all the people that come in and they've been everywhere and they've got, you know, lots of, might be upper neck pathology, could be anything. It's this that decompresses it, and it can be tricky to learn. I actually think it's a very easy technique. Once you know how to do it, you just need a bit of help with it. But sadly, I find with this technique that it's one that it's tricky at the start, and there's easier CD techniques, so people tend to prefer those. So I'm encouraging you, if you've kind of been a bit like that, keep practicing, because I cannot emphasize enough how much, for me at least, this technique is a super technique. That's just not my opinion. You know, there's lots of people that agree with that. I like to use a towel. Just gives me a bit of grip. So, where do people go wrong with this one? Again, it's body position and vector. Maybe slightly with handhold. Maybe slightly. That can be a slight one. Body position and vector is easy to correct because body position is really here. Again, get funky with it. Get down, get your body behind it. Really, you're going to be leaning your body into that there, and that's where you're generating a lot of your force. Then with your hand, it's a quick little flick. People get their hands slowed down because they come to the front, they try and do it with their hands. But the theme of this whole little workshop is get our body behind it, the vector's there, everything lined up behind that. So there's that. And then the way you're thinking about this is it's a decompression, so you're trying to open it up. So really when you're thinking about it, you're not trying to compress it in, just in your mind's eye, you're trying to open it up, and that'll give you a bit of an idea of how the facets are trying to move, which is important. Handholds. So the reason why handhold can sometimes be an issue here is because you can go to the rib head on that side, you can go right on top of the thoracic spine, or you can come at it from this side. And I don't have an answer for you. You know, that's one of those things where you just have to kind of have a little bit of a feel where it locks up and decide, make a decision. There's no right or wrong, it will just come with time while you choose it. But sometimes it could be any one of those three. Probably the most reliable and easiest is to actually come from this side. But often you don't want to hit the whole complex. Sometimes you just want to hit first rib, second rib, or third rib from this position. And if you come out right over it, it's a beautiful technique. What did I say the other thing was that where it goes wrong? I said body position, handhold. Can't remember. Oh, it would have been something like speed or something like that. Okay, so let's do it. Okay. So, again, position is kind of least important. Sometimes you'll just feel that you need to put this down a little bit, up a bit. I can't give you a real recipe for that, but most of the time I don't move this at all. Plinth is perfectly flat. There's no flexion, no extension, just flat. Side bending is kind of the main thing. Just let's say a side bend to 30 degrees, so it's not quite 45, it's off a little bit, and then a little bit of rolling to tension. So as I'm setting it up, I'm just feeling, and all I'm looking for is there's some tension. I'm all about tension. All about tension. I'm not, at this stage, I'm not really thinking about the facets. I've already done that. I know where the facets are going to be. Now I'm just after where's the tension. And so, now, Shahan, you should be fairly comfortable. Other than lying on the side of your face here, you should be fairly comfortable
yeah.
in terms of the pressure you've got there, the amount of rotation.
Yep.
You shouldn't be feeling anxious. There should be virtually no pain. Maybe this is what I was meaning before, where other people go wrong, is they have it so highly wound before they're doing it.
Really uncomfortable.
Yeah, and it's quite vulnerable for the patient. You know, they could go into anxiety quite quickly and kind of work against you. So again, I roll it. I know where the tension is, and that is where I'm going to manipulate from. So then I just let that off. So I know where I've got to push this hand to. Don't think about it too much. Just let your subconscious know where it is, and now don't think about it. Now you just have to focus on your vector, your direction, and get your knees bent. So that's just rolling there. Okay, nice deep breath in and out. Arms are nice and straight, and I just gently.
We already went.
If I come from this side,
Worst
again,
model ever.
vector this way.
Yep.
So like that. So most of it's down, body, not much hand movement. So if when we have a look at this back, we can slow it down and see I'm not actually pushing much. It's my body throwing into it and a little bit of pushing there. Would one of you guys like to feel that? It's always good to be able to feel it. Just jump up there, mate, if you can.
Good birthday. Manipped out of town.
My neck feels really good.
Well, and one of the tricks is, I'd always say don't manipulate an OA first before doing this. Because actually to do this well, you need a bit of that tension still up there. So if somebody's had their OA let go, and their AA, you're just not getting any tension out of the top of the neck.
Yeah.
You do need to get tension from there. So that's just a trick I've learned over time.
How do you explain to the patient this? Like, what do you say? I'm just going to move your head and thrust, or?
Yeah. Yep. I'll just let them. Well, generally they know. You know, like I mean, for you can feel that there, right?
Yeah.
So I'd probably anchor that to the patient as to why we're manipulating here. So we're just gonna adjust this and loosen this one up. So then, I'm just gonna lift your head up here, and we'll just gently put it on the side. There you go, just like that. So you should be feeling quite comfortable there. I'm just going to do this all at once rather than trying to explain, so you can actually see me do it in the moment rather than me losing my flow by trying to explain. So just nice deep breath in there and out. Okay, good. And same we'll do this side. Nice deep breath in and out. Just let this one roll. Beautiful. And already, just as soon as I start pushing down, you can just see that's different already, right?
Yeah, for sure.
Yeah. Let's just have a look at this. Did you want me to do that on you, just so you can feel it?
Do you want to try it on me? Well, and you can get feedback from Julian. I try and do this one a fair bit in clinic. I worked on it a lot last semester.
And
so
you're okay with it?
Yeah,
Oh, fantastic.
I like it.
Fantastic.
I mean, yeah, getting there, but
Yeah, but you're good. You weren't one of the ones that was scared off. Maybe 90% of my class were scared off it and
Well,
probably
we
still
didn't
don't do it.
actually learn it like this.
No.
It wasn't until we got into clinic and then some clinicians were like, oh, you can do it like this, but we were never like
We just learned to put
shown.
phones and
Yeah.
stuff. Yeah.
And so then I feel like I just kind of do it,
What,
but
we
it's,
just learned the lift, didn't we?
we learnt like the side one. We
Oh, like that. Yeah,
And
yeah.
the
We need to
seated
come-
one.
Yeah.
haven't done any, but so
Body position first. Think the vector. If I was doing that, I'd probably put this leg forward, other leg. Yeah. Is that how I'd do it? Yeah, no, I would because you've got to get your body in behind this arm.
what does that feel like, Alice?
it definitely feels like it needs to go.
What do I do then?
You can take a
Slow.
deep breath in and out and
Yeah.
kind of increase the
Okay,
tension.
take a deep breath in and out. Sorry.
No, I would say.
What did it feel like?
You probably didn't keep your pressure. That was
Yeah.
something that I always used to do.
Came
I'd
off.
take my pressure off and then try and slam down rather than build up the pressure.
That's a
Would be
really good
my
point. Yeah.
Feedback.
And you can build up that pressure slowly as you do it.
Yes.
Yeah. Have another go on this side. Yeah, that's it.
Deep breath in. And out.
How was that?
Probably the same thing.
Did I come off down?
No, I was like, I think you didn't let me get my full breath out. So I think if you follow it, like I always do the same thing with dogs. I don't follow the breath down.
Yeah.
And like, wait until.
And was I not forceful enough? Maybe if you do
Yeah, I
that on
think
her
you
and then
probably need to go a bit more.
faster.
Like,
Especially on that
from
one
my
side.
experience, I have to use a lot of
Yes.
like.
Plus,
push
we've
to
already
get
done
it.
the AA.
Yes.
Yeah,
so
okay.
You do get a little bit of, so just over to the side.
Full neck analysis.
Okay. So again, so I'm bringing that back and I'm really dropping down. You actually had this out a little bit, bent,
okay,
and you'll back away from it. So we might see that on the video later, just to prove that. You'll kind of hear. If you just turn your hand a little bit, maybe take up that with your chest. Get behind it, maybe over her head a little bit more, rather than back here. Try and push it over the head. Then we can just go like that. Oh, that wasn't very good. Okay, nice deep breath in and out. So we just do it like that. So in the end with that one, we actually had to have a fair bit of rotation. It's just sometimes hard to kind of explain and do it. And
I know, especially if you're not feeling it. Yeah.
But let's have a look here and we'll just have a look at a few things.
Massive.